Hi, everyone. So today is osteoporosis part 2. What else should I know? So if you missed part 1, we recommend that you go to our YouTube channel or you go to under the About tab on potentialpowernutrition.com. And the first one, osteoporosis prevention and treatment, is already up. But as we were doing that, we realized there was a lot more to talk about. And so today I am Dr. Mary Balliet. I am the co-founder and chief science officer, Potential Power Nutrition, also professor emeritus at Northeast College of Health Sciences. I'm a chiropractor and I have a master's in clinical nutrition. And I'm going to introduce Dr. Matthew Fraczek-Syczyk, who also is a chiropractor and has a master's in applied clinical nutrition. And Dr. Matt, you can unmute yourself for a second and say hi so everyone can see you on the side.
Perfect. Hi, everyone. Well, Dr. Balliet gave you a great introduction. I am a chiropractor and a student under Dr. Balliet back at New York Chiropractic College back in the day. I also have my master's in applied clinical nutrition, and I practice in the Albany, Schenectady area, and just happy to be a part of the presentation with Dr. B.
Yeah, so Matt does a lot of blood work and a lot of analysis, so he's quite an expert on this. So I'm going to start and then he's going to come in. So we did this last time. What is osteoporosis? It is considered an age-related disorder of the skeletal system, and it is characterized by decreased bone mineral density. And the problem is it has poor structure. And so when we look here, this is healthy bone, but this here called the trabecular bone, this is what loses the calcium, and this is weak then, and it can easily fracture, and that's the issue. And Dr. Matt's going to talk a lot more about can we predict fractures later. In terms of the anatomy, I think if we haven't seen the last video or we really would like a review, we want to remind ourselves that bone is not a solid piece of wood, so to speak. It actually has a lot of blood vessels, so it's called vascular, so we have to get a lot of nutrition to the bone. And we have these round things called the osteons that have the blood vessels in it, but these little blue guys here, these are the osteoblasts. They're the builders, and the rest is basically the structure or the cortical bone that is laid down by those particular things called osteoblasts we're going to talk about. And the very center is very porous because we don't want it to weigh too much. And that's really important. I think what everybody is reminding me when they watch that first video is that you replace your entire skeleton every 10 years. That is a really important concept here, that bone and adipose tissue and many things in your body, people think it's like, oh, I just shove calcium in the garage and it just stays there forever. That is not true. Things are happening all the time, whether it's bone or it's adipose tissue. Everything is much more like a warehouse. It's coming and it's going. And as we are walking every day, we have a little bit of structural problem here, and we have to cut out that problematic bone that got damaged by wear and tear of everyday life. Then we're going to have to remodel it by actually laying down some foundation of connective tissue. Then we're going to put bone in, and then it looks good. And we're going to keep on doing this all through our lives. So this idea that we can't get better just because we're older, I just don't really go for that. So there are two main cells. And the first cell was the one that has to get rid of the damaged bone. And those are called the osteoclasts. It's really important for these osteoclasts, which are actually cells known as macrophages. Macrophages are like little Pac-Man. They eat the bone up. And macrophages, when they're in the bone, are called osteoclasts. When macrophages, though, are other places in your body, like in your liver, they're called Kupffer cells. They eat other things up, and we have them all over our body. And so that's an important concept, that osteoclasts are just the macrophages in the bone. And because they're white blood cells, and inflammation means white blood cells, inflammation of any kind always increase osteoclasts in the bone. And maybe there's somebody else on the call. I'm not sure. I think okay. So what are these? What impacts osteoclasts? Having a very inflammatory diet can increase white blood cells everywhere, so that increases osteoclasts, so we want that to go down. And how do we decrease it? Intriguingly, hormonally. And we're going to see a slide in a minute that one person on the call told me about, and we're going to add that. But the hormones definitely decrease osteoclast. So women are known to have more estrogen, mostly estradiol, and then both men and women have testosterone, and men can have some estrogen as well. And the precursor to both estrogen and testosterone is this steroid hormone called DHEA. And so maybe you've heard of that sometimes people say, oh, you should take DHEA. And the other thing that reduces osteoclast is exercise. So we definitely want less osteoclast. We want the right number, but we don't want to have too many of them. Now, what do the osteoblasts do? They're the builders. So whether I am talking about bone or even I'm talking about other things, it's very important to have the builders. Thinking about just this stuff down here, the collagen, the calcium, the phosphate, that is the material, that's like the wood, but the wood is not the builder. The builder is this osteoblast, and this is what it shows right here. The osteoclast broke down the old bone, and the osteoblasts are going to build the new bone. But they need protein, they need magnesium, potassium, phosphate, vitamin K, and vitamin C. So they need a lot of other things. So if we just are saying, oh, calcium is all there is, that is just not correct whatsoever. And also, truthfully, we did a skin thing where we talked about collagen. You know, osteoblasts, when you eat collagen, it doesn't go directly from your mouth to the osteoblast. It gets broken down in your stomach to the amino acids, and then the osteoblasts have to remake the collagen and put it in the matrix, it's called, and then they put the calcium and the phosphate. And the vitamin K is really, really critical to hold the calcium in the bone, and that's why a lot of people are like, oh, you need vitamin D with vitamin K. And I didn't say it the last time, but I realized I should have said it, and that is that a good microbiome, having bifidobacteria and lactobacillus, they make vitamin K for you. So we did put it in the shake, 100% of the vitamin K, but really your microbiome's making most of the vitamin K you actually need in the right form. So what else makes you make more osteoblasts? And that is called Wolff's Law, weight bearing. So people in space always get osteoporosis, but when you do weight bearing exercise, even your own weight, then you have better bone. And this is why thin Caucasian women are at the highest risk of osteoporosis, because they're not carrying a lot of weight, which is very intriguing. So that's why it's so important to do weight bearing exercise. And what do most people say you need? Well, calcium, vitamin D, maybe they talk about vitamin K, maybe they talk about collagen. But we have to say over, you have to have the builders. They need protein, they need magnesium, they need potassium, they need phosphate, they need vitamin K, and they need vitamin C. So very important. If you don't do this, you got a lot of wood, no builders, unhealthy bone. So Dr. Matt and I met, and we did work together, and he took this incredibly great course about blood work. And so I'm going to let you actually, Dr. Matt, do this slide. How can we increase our steroid hormones that decreases inflammation? What should I eat?
Sure. And really, it comes down to, it's really more simple than it is complicated. You know, we talk about eating healthy fats, which we know from our, avocados, salmon, healthy fishes in that regard. Going back to the exercise, and not only the weight bearing exercise, which is good for, building strong, healthy bones, but aerobic exercise, which is more conducive to creating more proper hormones for our body as well. And so Dr. B mentioned early on that I do blood work with a lot of my patients. And so doing some advanced blood work testing, we can do hormone panels where we can look into actually estrogen, testosterone, and DHEA for each patient. And it can better identify where along the chain someone may have something nutritionally wrong, or where we can help them nutritionally or holistically, whether it's with supplements or having a better diet or exercise along those lines. The other thing that's sometimes even more important, in my opinion, than the do's is the don'ts, which is really easy to do. Eating our processed sugars, our greasy and fried foods, all those things can really throw everything else out of balance. The other study that we read, that I read rather, talked about alcoholic beverages, and Dr. B has her, I remember mentioned that it's different for men and women for how many they can consume and have an effect on their body. But overall, the research showed that having less than 7 to 10 drinks on a weekly basis was better results for people overall. And also I said not to sleep on mental health or not to sleep on getting sleep, because mental health is really important. And Dr. Balliet has a whole nother presentation on sleep and how that's important for not only your hormones, but your overall health.
Yeah, that's really true. So we have a whole nother video that you can check out on the importance of sleep. And it turns out that hormones are really impacted by sleep. And that's why menopausal women or perimenopausal, where they're not sleeping well, they can have a real problem. The reason that the alcoholic drinks are really an issue is that it shows that for people who are not good digesters, to have one drink with their meal at dinner may actually help them absorb their food better, but too many, that causes inflammation. So there's that sweet spot. And when we talk about one drink, my favorite thing is when they show those different size glasses and they're like, oh, it was only one drink, but it's a really big drink. One alcoholic drink is considered 6 ounces of wine or one bottle of beer or just a shot of hard liquor. So it's not, you got to get the actual serving size there on that. So this, we want to thank my friend Jane, who's on the call, who just sent me this. It's super cool. And that is that it was published yesterday. So we're really, but I put the date in because people might be watching this a little bit later. And we know that when you're older, you don't heal your fractures well. And that's really why we don't want to get an osteoporotic fracture. And they found out that when you are breastfeeding, even though you're putting all that calcium in the milk, mothers who are breastfeeding have increased bone mineral density, and they didn't know why. So here is the study. And so we're going to go here to the study, and it turns out that breastfeeding women make a hormone that makes their bones strong. Now, that hormone is really interesting. It's called CCN3. So that does not sound so exciting at all. But now that they're trying on mice, they have no human studies at all now. It's just mice. And they happen to be studying in the article female mice. And before 2000, even the mice were not female, which I think is really interesting. So we've only known about females and how they respond since 2000. Because before that, they were like, oh, the hormones, it's so confusing. But in elderly mice, bone fractures do not heal well, neither do they in humans. But they put this hormone that breastfeeding mice make, as well as breastfeeding women, called CCN3 on a patch. And guess what? It healed the fracture. So that's a very exciting news because we didn't really address the bisphosphonate, Fosamax, which just turns down the osteoclast, but it doesn't actually make you make more osteoblasts. So it's not letting you get rid of the bad bone. This would actually be much, much better because it's helping the good guys, the osteoblasts. So then Dr. Matt's taking over.
Yeah. And so now getting into a little bit of the diagnostics of osteoporosis. Typically we have the DEXA scan. And so DEXA is just an abbreviation for dual energy X-ray absorptiometry, which really it's be good to have for in your pocket for you go to trivia nights on Thursday nights. But besides that, all you need to know is that the DEXA scan is good for measuring bone mineral density. And bone mineral density is split up into 2 different scores on the DEXA scan, a T-score and a Z-score, which I'll get into in a little bit, which was classified 30 years ago by the World Health Organization in 1994. And so basically and it's been established since 1994 that diagnostically a T-score of negative 2.5 or worse is diagnosis of osteoporosis. So the T-score, so what does the T-score mean? So we have a nice little visual on the right side here. The T-score is usually taken anything from -1 and above is considered normal. Anything from -1 to -2.5 is considered osteopenic or a softening of bone. And like I said before, -2.5 and worse is considered osteoporosis. Now, T-score is, oh, sorry. So
Am I going
T-score, oh no, back. So T-score is a comparative measurement. So it's a measurement comparatively to your, so basically negative 2.5 is your own bone mineral density compared to your own peak bone mass. And then as opposed to the Z-score, which the Z-score is a measurement of your own bone mineral density compared to someone else of your own age, gender, or race. So for example, if I had a bone mineral density of minus 2 on a T-score, that'd be, if you go on the left column here, the 1.2 at the top there, that'd be a 0 T-score, compared to if I was the red dot there at 60 years old, I'm negative 2 compared to what I was, whatever it was 20 years ago. Then the Z-score is negative 0.5, which is relative. The skinny line in the middle of the white line there is basically the average decline of every person. And so whether, as you can see, it's around the 40 to 50 age range, which is around time that most women go through menopause and men would consider andropause. So it's a huge shift in hormones, which we talked about earlier, is a huge impact on bone mineral density. So the Z-score is not as diagnostic, but is a good way to compare yourself to other people your age, and to compare. It's easier to compare when you're trying to improve your bone mineral density, how you are compared to other people your age. And so Dr. B, actually, this is her own DEXA scan here. So it's kind of cool that we can go into it here a little bit. So you have a similar looking graph on the bottom left here. And so you can kind of see the 3 declining lines there. And so basically everything in those, inside those lines there is considered osteopenic, right in that area. Anything below the bottom line is osteoporosis. Anything above the top line is considered, normal bone based off of your age. So we can kind of look at the graph, or the table rather, on the right side. And so looking at the young adult T-score, so that's comparing again her bone mineral density to her peak bone mass when she was in her like 20s or 30s, which is when they consider peak bone mass. And then looking at the Z-score, which is compared to her people, or compared to the same people in her age range, or age, gender, and race, for someone her age. So as you can see, she's for the neck of her hip, the left and right, she's minus 1.9. All of those are in the osteopenia range, but not into osteoporosis. But comparatively looking at the Z-score, seeing it in the 0.2.1 is good for, so it's good comparatively for someone her age, because she takes really good care of herself.
Yeah, so you can have a Z-score like we saw on the last slide, where your Z-score is still minus 0.5. You're still below the average for your age group. So I was super happy when I got these results. So this is a year ago, and a little bit more than a year ago. And so I was very happy to see, for my age, I was above on the Z-score. Now, compared to where I was over here, then I am down. So you can see those 2 little dots in this white osteopenia area. But remember, I got to get all the way down here to 2.5, minus 2.5, to be osteoporotic. So we wanted to do this so that everyone can now go and read not only their DEXA scans, or maybe their patients or their friends, so that you really do understand these 2 scores better. We really wanted to get that done in this presentation.
Yeah, and so now we want to talk about the clinical significance of the DEXA scan. So we talked about the bone mineral density being diagnostic for osteoporosis of a negative 2.5 T-score, but as some of the research articles we read, they're not always the best for determining your risk of fracture. I know I have a lot of patients who have their DEXA scans are -3, -3.5, and they're coming to me like the world is ending. If they're afraid if they take a step, they're going to break a bone. And I understand the scared, how scared they are based off of all that information, because it sounds like unrealistic of everything that they could do there. So basically what's more important than the actual number of -2, -3 is the rate of change over time. So if Dr. Balliet was, let's say, -1 3 years ago, and now last year she checks and she's -2, for example, that's a significant change over 2 years. But if she was negative 1.5 and now she's negative 1.6, 1.7, it's a very, very slight change over the time. So what's more important is the rate of change of her bone mineral density versus the actual number. And that's why it's important to get your DEXA scan checked often, but also starting at an earlier age. And I think they don't start to recommend it every 2 years until you're 65 years old. But I think it would be beneficial looking at the graph of when it starts to decline, of probably in your 40s or 50s would be better to actually diagnose and check for the rate of change. But we read some more articles. It's actually what's better is to look at some specialized blood tests to investigate further. Unfortunately, not a lot of insurances will cover these blood tests unless you're on a medication like some of the bisphosphonates out there and the Fosamax. We read up on them, and some of the blood markers are pretty accurate. But the problem is that they're really utilized in measuring the change of bone mineral density based off of the medications that people take, as opposed to things that they can do healthy wise to improve. And so getting into the prevention of osteoporosis, we have what we know are macros and our micronutrients. Our macros being our proteins, fats, and carbohydrates, and our micronutrients, all our vitamins and minerals. And we're going to get into all of those as we go along here. And so starting with the macros, we've got our protein. And so a lot of people know protein, and usually associate that with muscle mass. And it's obviously it's important thing to think about, because we can actually, a good predictor of someone who is more risk of having a fracture is based off of their lean muscle mass. And so we talk about the overall bone mineral density is also related to the cross-sectional parameters of bone strength in general. And so we want to look at people who have a loss of muscle mass over time. There's going to be a high association of them losing bone mass over time. And so that, as we talked about in the past, the ideal intake of protein is at 1.2 to 2 grams per kilograms of body weight. And I deal with a lot of patients who have osteoporosis, and a lot of them are women in their like 50s to 60s or 70s, and some of them are like fit this category to a T. They're 110 pounds soaking wet, and they're like, well, I don't need that much protein if I'm 100 pounds. I did the math. If you're 100 pounds, you need a minimum of about 55 to 60 grams of protein a day, and that's 20 grams of protein at each meal. And for a lot of people, they're not even hitting that, and that's a bare minimum of what they need. Digging deeper into the protein itself, as we know, protein are made up of amino acids, and there's a lot of them out there, and I'm glad I don't have to memorize them all over again. But two of them that are important we have is lysine and arginine, which are shown through research to have a positive influence with nitric oxide and the production of type 1 collagen synthesis used in the prevention of osteoporosis, which kind of goes along the lines that Dr. B was talking about earlier. With collagen, a lot of people are taking the collagen, they put the powder in their coffee or their protein shake. And as Dr. Balliet mentioned earlier, our body has to break it down into these amino acids to then utilize it again. So it may be more efficient to take the protein as amino acids in general than just taking collagen and then breaking it back down again.
Exactly. And then this arginine here, I just thought that what's interesting here when it says NO for nitric oxide, if you don't have enough arginine, which is a conditionally essential amino acid, then you cannot have your blood vessels dilated enough so that you get enough blood to bring these amino acids from your liver. They came from your intestines. They had to go through the blood to get to your liver, from your liver to the bone, to the osteoblast that remakes the collagen.
So it's exponentially important. So from the protein onto fats. And so we've heard of our saturated versus our MUFAs and PUFAs, our monounsaturated fatty acids and polyunsaturated fatty acids. Most of us know that it's important not to have too many saturated fats, which if we look on the left-hand column there, it's our beefs, our porks, our, hot dogs, sausages, everyone going down to the baseball games, eating those types of foods, our whole milks and butters, the coconut oils and palm oils, which a lot of people like to bake and cook with in general too, because they taste good. So I don't blame you. But it's important to replace them when necessary, or when possible, with unsaturated fats such as olive oil and different types of fish oil. and specifically what breakfast blend has with the sunflower lecithin, which is added, which is a good unsaturated fat in general there. So the role of fiber in osteoporosis, we read an article that showed that water-soluble fiber, having more water-soluble fiber in your diet elevated our retention of calcium in the bone, which is really, really important. And it's just a friendly reminder looking at the carb to fiber ratio. And I'm always reading food labels, and I'm trying to teach patients to read their food labels about having a less than 10-to-1 ratio. So for every 10 grams of carbohydrate, we want at least 1 gram of fiber to be able to break that down and to not, not only spike our glucose levels, but to be able to absorb it and properly and have obviously help with the retention of calcium in our bones too. Oh, sorry, there was one little thing on the bottom corner I missed. And so Dr. Bailey also added that diabetes can lead to the reduction in bone mineral density. That goes on, that's a double whammy, because really diabetes can lead to inflammation, which we already know inflammation breaks down the bone. And so it's important in diabetes prevention, to also look at our carb to fiber ratio as well. So now getting into the microminerals here and for osteoporosis prevention. So first of all, we want to build more bone, which, we also know that calcium is part of it, but calcium is the wood to lay down the bone, or is the wood to build the houses for the bone, calcium and phosphorus. So we know we need that in general, but we also need our builders. So our builders include the phosphorus, magnesium, zinc, selenium, copper, and all your vitamins A, C, D, K, and B. A lot of B vitamins. And so it's really hard to, eat a well-balanced diet to have a lot of that. You have to have a lot of nuts. I always tell my patients with selenium, have their Brazil nuts, a lot of nuts in general, almonds, walnuts, have your zinc, your copper, magnesium. So it's easier to get that if you have trail mix like I do all the time, sometimes ad nauseum. But it's important to get a well-balanced of all your microminerals.
Then there's a fabulous study that says that quercetin is protective against age-related bone loss. So quercetin, we can see in this picture here, is this yellow color. And so anything that has that yellow color has quercetin in it. So if you have like a gala apple, that has quercetin. Berries have quercetin. Peppers, great. Cruciferous vegetables, because they turn yellow when they go bad, so to speak. Anything that as it ages turns yellow when the chlorophyll goes away, which is the green, and it has yellow, that means it had quercetin in it. So cocoa, intriguingly, also has quercetin in it. We expect citrus fruits, because quercetin is the thing in naturally occurring foods that keeps the vitamin C in the right form that lets you make the collagen in the first place. So collagen is a vitamin C dependent pathway, and vitamin C has to be in what's called the reduced form, and quercetin and rutin and rose hips are all critically important, but quercetin has some of the best data of all time. And so everybody's like, oh, it's the resveratrol in red wine, but red wine also has quercetin, as does onions and anything that has a color. So even olive oil and beans. So capers, everything that has this color has quercetin. It will keep the vitamin C that's also coming with that in the form that will let you make the best collagen, because you have to always remember, I have to make the collagen. That's the take home message. It's not going from your mouth to your bone. It's getting broken down and remade. So having adequate protein is more important than having only collagen. So what happened? We wanted to add a couple more slides here. We wanted to add the DEXA scan slides. We wanted to talk about the new material, but we also wanted to say what happens if you're on certain medications. There's a bunch of medications that cause a drug-induced nutrient depletion. And so glucocorticoids are the #1 most problematic. That's the prednisones, the cortisones. Maybe you have a rash and you're doing cortisone, or we're just really sick and you're on prednisone. They're going to deplete not just calcium, they're going to deplete all of your B vitamins, all of your minerals. So now you're going to basically need to have everything we talked about, one for you and one for your drug-induced nutrient depletion. We're going to talk about your proton pump inhibitors when we talk about stomach acid, but it's necessary to have stomach acid to both digest your protein, which we said you need, and you cannot absorb calcium, magnesium, zinc iron, any of those, what are called divalent, or they have a +2 number, you must have stomach acid. Many people today are on SSRIs. Those are the Prozac, the Celexa, all those serotonin, selective serotonin reuptake inhibitors. They also, because they impact the bowel, impact your protein digestion, not as much, but your calcium definitely. So you may need to eat more greens, things that have a lot of calcium in them naturally, because you want to have calcium not just as a supplement, you want to have it in food. So not just the dairy, but the greens have both the calcium and the magnesium. If you know someone that's on an anticonvulsant that ups your calcium need, if this is what's we talked about the importance of estradiol, but some people are given progesterone. And when Dr. Matt and I talk about, we're going to write a thing about the hormones, and we're going to talk about the way that steroid hormones are made. And progesterone is way over here in this one part in the first stream of steroid hormone synthesis. And progesterone can become cortisol, and cortisol is a glucocorticoid. So that's the reason that progesterone can actually elevate your need for more calcium. If you're on a chemotherapy, that can really mess up with your microbiome and your vitamin K and anticoagulants. Not all anticoagulants, just the Coumadin, warfarin anticoagulants. That's because vitamin K is necessary to make a specialized amino acid that holds the calcium in the bone. So without the vitamin K, you can't make the actual amino acid in osteocalcin that holds the calcium in the bone. That's critical. And calcium is necessary to blood clot. And so that's why they go together. So any of these medications that we're seeing, we're going to actually have to increase our amount of calcium containing foods. It's really important as much as possible to have it in foods, the greens, as well as the dairies, the nuts, the seeds. What about if I just am so stressed out, I have less stomach acid? Maybe I'm not even on a proton pump inhibitor or H2 histamine blocker. You can do the baking soda stomach acid test. It's basically built on that same idea of making a volcano when we were in school. First thing in the morning, before you eat or drink, you mix 1/4 teaspoon. This is more than that, but just 1/4 teaspoon of baking soda. This is what's important, 4 ounces of cold water. I would do filtered water, but still you need the cold water. Now you're going to mix it together. You're going to drink the whole thing, all 4 ounces. You're going to set a timer. You should burp within 5 minutes, 3 to 5 minutes. You should burp. That's because stomach acid acts like vinegar, and the baking soda is baking soda, and it makes a volcano. If you don't burp, you do not have enough stomach acid. That means you may need, this is why apple cider vinegar or doing, a teaspoon to a tablespoon of apple cider vinegar may help you. And that will help you digest your protein and absorb your calcium and your magnesium and your zinc. And finally, everyone who goes to space gets bone loss. They lose 1 to 2% of their bone mineral density. So you must do weight-bearing exercise. It's absolutely critical. And then we put this in the last one. Here it is again. There's lots of great examples of weight-bearing exercise. But again, if you're in space, if you're sitting on the couch all the time and you're not doing weight-bearing exercise, that is a problem. I read a paper in 2010 talking about those osteoblasts. Intriguingly, they have these little hair cells on them, and when you exercise, as the blood flows in, they wave, and that's the signal for them to wake up. So if they're just sitting around, they don't get the signal to wake up. So intriguingly, people who are fidgeters have better bone mineral density than people who are not, because they get that little wave. So any kind of movement and weight-bearing exercise, really, really important. And so we're going to end this. If you need either of us, you can contact me at mballiet@potentialpowernutrition.com, and you can get Dr. Matt Fraczek-Syczyk at drmattdc@outlook.com. So we'll stop this and talk to our studio audience.